Hello, my name is Vicki Kennedy and I welcome you to this webinar on behalf of the Edward M. Kennedy Institute for the United States Senate. We come together today at a difficult and unsettled time in this country and indeed around the world as we grapple with issues of racism, health disparities, economic devastation, and a new global pandemic. We originally planned to meet in person to discuss the 30th anniversary of our nation's response to the HIV/AIDS crisis. But the highly infectious COVID-19 viral infection that we're still trying to understand has required us to come together this morning virtually instead, via Zoom. We're honored to partner with the Elizabeth Glaser Pediatric AIDS Foundation to highlight an issue that was very important to and close to the heart of my late husband, Senator Edward M. Kennedy, the fight against HIV and AIDS. But before we get into the substance, I must say that there is someone who has helped us to put together this program today and who is at my husband's side every step of the way, Michael Iskowitz. Michael, I want to say thank you for everything that you have done all along the way for the past 30 plus years. When my husband was looking for someone who was the best, he asked the late, great Matilda Krim, who was the person, and she said it was Michael Iskowitz. And then, and now, he still is the best. Thank you so much, Michael. My husband also drew his inspiration from 15-year-old Ryan White, who got HIV from a blood transfusion and was then thrown out of school and run out of his community due to fear and stigma. Senator Kennedy knew that at times of fear and challenge, Democrats and Republicans needed to push past partisan politics and join forces for the greater good of our nation. He worked tirelessly with Republican Senator Orrin Hatch to craft and pass the Ryan White Comprehensive AIDS Resources Emergency Care Act. The act brought for the first time federal dollars, treatment, and community-based care and support to Americans living with HIV and AIDS. Over 40% of Americans living with HIV/AIDS receive treatment covered through this program, and hundreds of thousands of individuals are alive today because of the resources and funding Senator Kennedy fought for 30 years ago. My husband also worked to help eradicate AIDS around the world and was an author of the landmark Presidential Emergency Plan for AIDS Relief, PEPFAR legislation, that was signed by President Bush. I think it worth noting how well my husband and President Bush worked together on this legislation and on other legislation, even though they disagreed on other matters. That is what this country does when it's at its best, and I believe with all my heart that we can get there again. When PEPFAR passed, fewer than 50,000 people in poor countries were receiving life-saving AIDS treatment. Today, more than 25 million people are still alive because of the expansion of care and treatment. Senator Kennedy was inspired by youth and advocates who wanted to make a change, and we are honored to have two youth advocates join us today, Lucas and Josephine, and you'll be hearing from them later. Moderating their conversation is Mike Gerson, esteemed columnist at the Washington Post who worked with President Bush during the passage of PEPFAR. Thank you so much, Mike. I'm now pleased to introduce Chip Lyons, President and CEO of the Elizabeth Glaser Pediatric AIDS Foundation, a longtime advocate for global health. Chip has served as a member of the Human Rights Watch Health and Human Rights Advisory Committee, U.S. Representative to the Executive Board of UNICEF under President Barack Obama, and Director of Special Initiatives in the Global Development Program at the Bill and Melinda Gates Foundation. Thank you, Chip, for your leadership and partnership on this program, and to the entire team at the Elizabeth Glaser Pediatric AIDS Foundation. Chip?
Mrs. Kennedy, thank you. That's very kind of you, and it's a tremendous opening to this webinar. And I want to thank also the Institute, the Edward M. Kennedy Institute, for organizing this, and for the hundreds of people that are joining us from multiple time zones and multiple continents. So it's a great opportunity to be together. You introduced me. I'm the CEO of Elizabeth Glaser Pediatric AIDS Foundation, EGPAF. I think you know very well that our mission is to end HIV and AIDS globally in children, youth, families, and we do so through prevention and treatment programs, through research and advocacy across 17 countries. We support thousands of sites and 1.7 million people on treatment for HIV, life-saving treatment that they are on. The nature of our work and the nature of HIV is that you always have to adapt. There are new problems that arise. There are new challenges that we have to confront. And COVID-19 is the latest, and I have to say is one of the larger challenges that we're having to face in real time. I've been on the phone a couple of times already this morning with colleagues in the DRC and in Ivory Coast, and just reminded day to day the kinds of difficulties presented by COVID. It's too early at this point to know really and have the data that tells us as much as we need to know about COVID and how it affects children, how it affects young people and others with the underlying condition, obviously, of being HIV exposed or infected. But I want to emphasize EGPAF itself, because of Elizabeth, because of Senator Kennedy. In many respects, it's fair to say EGPAF was born of negligence towards children. At the early days of HIV and AIDS, it was not thought to be an illness that would affect children. Nothing could have been further from the truth in terms of Elizabeth and her own children. And we just can't make that same mistake and somehow think children or young people are going to be immune or unaffected by this. And so our own research and the work that others are doing to see and understand children are different from adults. They'll react differently to disease. They react differently to medications. They have different diagnostic requirements. But if we aren't focused on children from the outset, we will lose track of them, and we will not meet our obligations. In so many respects, this is kind of a full circle opportunity for us. Senator Kennedy is a hero to EGPAF. Elizabeth Glaser was knocking on doors. Not all of them opened. Senator Kennedy's opened widely, and you recounted his leadership and his contributions, so I won't repeat those. And to your point about, we'll get there again in terms of working in a bipartisan way. This is almost a quaint notion at this point, but the first fundraisers for EGPAF in Washington, D.C. were co-hosted by Senator Kennedy and Senator Orrin Hatch. We long for the days when partisans on the one hand joined together when the matters were as important as they are today. Our purpose today really is to hear about how COVID is affecting young people. In particular, in those of you that don't know, there are as many as 10,000 adolescents that are infected with HIV every single week around the world. 20% of the new infections in the United States are among young people. So HIV and AIDS is still present, it's menacing, it's disrupting, it's taking lives, and there's so much more that we can do. But if we're smart, we will listen to young people. They will be a part of their own treatment design. They will help inform the best strategies and messages and services for young people, because They are not going to be identical to that which serves adults. And PEPFAR exemplifies what can be done in a bipartisan way, in an all of government way with substantial. There's almost nothing we can't do if there are resources commensurate with the challenge. And we have enormous challenges still with HIV and with COVID, and we're going to hear more about them today from Lucas and Josephine. So I think we've enough from us, the older 60 crowd. Let's go to the under 30 crowd. Michael's somewhere in between the two.
Close to you.
We look forward to hearing from Josephine and Lucas. They are remarkable in their leadership, their knowledge, their experience, and how they pull together people together as we are today. And Mike needs no introduction. Vicky already did that. But in addition to being a sort of well-known columnist, I think more importantly, and more important to Mike, is he is a tremendously respected columnist. There are a few more thoughtful, reasonable, intelligent voices in the public today than Mike. And thank you for that. And thank you very much for being with us and moderating today. Over to you, Mike.
Great. Well, I appreciate that. That's much appreciated. It's a pleasure to be working again with the Glaser Foundation, which I have so much respect for, and to be working for the first time with the Edmund Kennedy Institute. But most of all, it's really an honor for me to be with these panelists who are youth leaders in different cultural settings, but are living lives of similar courage and conviction. At least some of us here remember the early days of the global response to HIV/AIDS. It was a time of uncertainty and fear, and then eventually dawning hope. It was a period of challenge, but it also saw bold leadership and close cooperation of people such as Senator Kennedy and my old boss, George W. Bush. And it saw the rise of new leaders in the US and Africa who worked as full partners in a great cause. At least to me, the early days of the global response to COVID-19 have a similar feel. There is uncertainty and dislocation. COVID is putting major stresses on health infrastructure with lockdowns and closed borders and disrupted supply chains. And this is having an effect on HIV service delivery. And we are in need of bold political leadership. But people of conscience are rallying around the world to raise awareness and protect vulnerable communities. And that is the hopeful message of the young leaders who join us today. Josephine Nabukenya is a Glaser Foundation ambassador, an advocate for youth living with HIV, and a psychosocial support counselor for her peers in Uganda. Josephine learned about her status as a child and has used her voice to help hundreds of others stay on their medication and live healthy lives. Josephine published her first book last year, Beyond Your Status, in which she shares her life journey and encourages young people to know their status and get on treatment. And this month, Josephine was elected to both the Foundation's board of directors as well as to the board of the International AIDS Society. It's impressive. Lucas Courtney was born in Oakland, California, to a mother who used intravenous drugs and contracted the virus, passing it on to her son. He entered foster care at age 2 when his parents adopted him. They waited until he was 10 to tell him he was HIV positive after working hard to build a normal childhood around his frequent health challenges. Today, Lucas is a healthy, active young man who enjoys sports, works a part-time job, and spends time with friends. Lucas now lives in Massachusetts and supports the Foundation's mission to end AIDS in children by speaking at universities and events across the country. Josephine and Lucas, welcome to you both. Let me start with a question for you both. How are you coping during the COVID-19 outbreak? What are the particular challenges for young people with HIV, both in Boston and Kampala at this time of the pandemic? Josephine, you want to go first, maybe?
Yes, I'll go first. Thank you so much for that introduction and for the question. Well, there are a number of challenges that are being faced by different young people across the country. But there are three major challenges that we cannot, leave out when we list them out. And one of them is accessibility to the health centers. Well, our kind of setting, when the lockdown came up, public and private transport were all stopped. So it was very hard for people to access health centers to go and pick their medication. And our lockdown was not so planned, like they didn't give us a week or a day for the lockdown to be. We were just told within 2 hours, no more movement. So, if you didn't have medication that was going to last you for a week or a month, then, you had to find other means of getting the medicine. And that was one of the biggest challenges that we faced throughout the lockdown. Currently, we are in a phase where the lockdown is being eased. But even when it is being eased, public transport is too expensive. So still people cannot afford to access the different health facilities where they have to go and get their medication. The other challenge is food. I know I'm coming from a point where we are a developing country, and most of us or most of our parents or our relatives or our friends are depending on what they earn on a daily basis. So if there is no work for a day, then there is no money. If there is no money, then there is no food. Now, that is another scenario. When it comes to a person who is taking medication on a daily basis, you cannot take ARVs on an empty stomach. So you'll find that some young people have been skipping their medications because they didn't have food to take before the meals. And this has been going on for like a week and then a month. Then you get phone calls, we don't have food, we're not taking medication, the government is giving out food, but it cannot reach the entire country. It cannot reach each population. So I find that some young people, actually most of the young people, do not have food. So because of that, they end up skipping their medication. The other third challenge that I cannot leave out is, disclosure that is not planned. So because of the nature of the lockdown, most of the young people, especially those that were in school, they didn't think it would take a month, 2 months or 3 months. So when the lockdown happened for 2 weeks, someone was like, okay, it's just for 2 weeks, let me go to a friend's place, or let me go to a relative place, a distant relative within that area. So they didn't consider traveling back to their homes. And because of that, remember, they have to take their medication on a daily basis. So you're in a family of probably like 12 people, you have like 2 bedrooms, definitely people will see you take medication on a daily basis. And through that process, you'll have to disclose your HIV status because you can't keep on lying to the people that you're staying with. And that has caused other issues like physical abuse, especially to young people that ended up seeking shelter, probably like a boyfriend's home or another person's home, and then because you didn't disclose to them, and then you're taking medication on a daily basis, and people know our teens, they can easily see a teen and know, okay, the ARVs is that teen, and because of that you can end up facing gender-based violence issues, especially physical abuse. So those are the 3 challenges that currently in Uganda we are facing: accessibility to health centers, a lack of food to people because people depend on what they earn on a daily basis, and unplanned disclosure that has been taking place. Thank you so much.
Sure. Lucas, how are you coping with COVID?
I can speak to it's not, I don't have the same issues as Josephine does, but on a different level. Back here in Boston, where there's been a number of protests in the recent days, in the past week, I went to one myself, and the biggest problem for me is contact with others, because I know I have a compromised immune system, so I have to be extra cautious about wearing my gloves and using my hand sanitizer, always having a mask on, and really like being aware of who I come in contact with and making sure that I use it every single turn. Because even though I do take my medicines for my suppression, it can still affect me in ways that are negative. So I need to always be wary of where I touch, where I eat, who I see. And it's in a way, it's more of a privilege than Josephine, and I'm aware of that, which is why I need to make the disparity over there. This is a different issue. But back here, it's mainly just being aware of yourself and being aware of your health and who you're coming in contact with.
And Josephine, just on that point, how has COVID changed how you engage with the world in the last few months?
Listening to what is happening to the entire world, and also learning from what other people are doing in other countries, we've been able to come up with some solutions to some of the challenges that were happening. But definitely, there are some solutions that we would want to do, but because of the government guidelines, you cannot do them. For example, we've been delivering. Some of my peers have been delivering medication to families, but that is done still under a lot of care, a lot of safety, and still you cannot reach all the families that you have to reach to. So we've been looking at what is happening around the world, seeing how other peer educators are taking it in other facilities, and also see what we can actually do within our country, within the guidelines that have been placed.
Yeah, that's great. Lucas, to move on to another question, what might adults not understand about young people when it comes to HIV?
There's a lot that adults and leaders don't understand, because when you're growing up, you feel like all your friends and you're the same. Mm-hmm. For the longest time, I felt that way after I was adopted and I came over to the East Coast. And then once I was told about my status, it kind of flipped my world upside down for a little bit. I kind of begun to question if I'm the same as the other kids, like if I'm gonna die sooner than the other kids, and like it just raises a lot of questions that a kid isn't really equipped to deal with at the moment. Yeah. And growing up, I know I got in a lot of fights. I got bullied. I got harassed, and I got beat up because of my status, and that's a lot of people don't understand. I have a brother and sister who also are positive, and we were both adopted as well. But my brother is of color, so he got it worse than me. So I had to do a lot of nights of hearing him going and tell me about how bad his day was, and then they just don't understand how unforgiving some kids can be when they don't understand what's going on. And that was a big thing for me.
Josephine, on a similar kind of question, how did you learn about your status and how did you adjust?
Well, it was I learned about my status in two ways. The first time I learned about my status, I wasn't supposed to actually positive. So my mother was very sick. She was bedridden, and as a child at home, I had to do housework. So I was taking care of her bedroom, and then I landed on, she says it was a will, but to me I saw a letter. So I always say I landed on a letter that I wasn't supposed to read. But in that letter, or in that will, she had stated that she was having AIDS, and she thought she was going to die because at that particular moment, she had only one CD4 count. She was paralyzed, half of her body. She was almost like dead. She couldn't even remember our names at one point. So that is when I learned about my status. I kept quiet because I knew I wasn't supposed to read the letter. So I kept quiet about it. But after some time, my mother didn't die. She's still alive even up to now. So after some few years, she learned about the importance of disclosure and letting your children know about the HIV status. She then disclosed to me. So I learned my status illegally, and then afterwards legally from my mother.
Oh, that's interesting. Can I just ask, how should children be told about their status? Do you think, from your own experience?
Sorry, come again?
How should children be told about this? At what age? How should they be told?
Wow, I think it all depends on a child. There are certain children, when at the age of 10, they're very clever and they can understand everything. There are kids, when at the age of 10, you cannot start to talk about HIV because probably, they're not, I wouldn't say too smart, but, they may not get it quickly. So it depends on the child, but different ministries of health have a set standard, and I know in my country, the government recognizes at the age of 12. So by the age of 12, everyone should be knowing the HIV status. But we know that some children at the age of 10, at the age of 11, they are very inquisitive as to why they're taking medication on a daily basis. So in such scenarios, you can start with partial disclosure so that by the time a child reaches 12 years, they really know about the HIV status. And another key thing when disclosing, it is very important for the primary healthy caretaker, and in this case, it can be the parent. If it is not the biological parent, then the person who is always with that child. They should be the primary people to be empowered to do that disclosure. I don't believe in someone else disclosing to a child. I believe in the real parent or the primary caretaker disclosing to the child.
Lucas, Chip mentioned that more than 20% of new infections in America come from children, among children aged 13 to 24. What do you think are the factors that are driving these new infections among young adults?
I talked to a lot of my friends about this, and what they think is I went to a program where I met a lot of HIV youth that I grew up with, and the biggest thing is the age of 13 is starting a time of puberty, and that's a time of exploration and sexual activity and becoming active, and that's natural and healthy. But you have to also understand that there are risks that come along with being HIV, going positive, and being sexually active. And it's not a bad thing to have it and do that as well. It's about being aware. It's about having all the facts, all the info, and being safe. And of course, that time you're going into high school and in college around that time, and it's just a matter of being safe in your surroundings and knowing what you need to do to make sure that you don't pass it on to someone else, and to make sure that you're being safe.
Josephine, we know that AIDS is the leading cause of death among young people in Africa. What are the factors that are driving infections there?
Well, the number of factors that are driving to the infections in not only Uganda, but like Southern Africa. And one of them would be, late diagnosis. Some parents really get to know that they're HIV positive when it is too late. So, they end up passing HIV onto the unborn babies, even though we've seen that, of course, due to the EMTCT services, elimination of mother-to-child transmission has worked. But due to some, some other challenges, you find that still some parents, get to know the HIV status very late, and, they have nothing much to control. And then the other issue is still about the sexual part of it. I come from an African setting, and trust me, in our setting, I've never had my mother talk to me about sex. So, I mean, I come from that setting where such conversations cannot just happen. So if they cannot happen in a family, then where else will they happen? Probably they're happening within peers, within a circle of young girls or young boys, and they don't have the right information, and they may, end up making decisions that have put definitely, their lives into danger. The other issue is about HIV fatigue. Sometimes when I go to the community to do sensitization, you hear people say, HIV again? You understand? Like someone says HIV again, and they're like, yeah, it's still HIV. You have the figures, the infection rate is too high, but then someone is still asking you HIV again. Somehow like they're kind of fatigued, but then through that kind of fatigue, they're missing out information still. So because they're missing out information on how they can, have safer sex, and, how they can protect themselves, still they end up finding themselves into, risky behaviors that are putting them, at a point when they have to contract HIV. And definitely the other issues would be around, PrEP and then PEP. These are things that we as people living with HIV, we know so much, but then when you go to the community where people do not have HIV, they're not infected, they do not know so much about these services. They're not, widely spread out there. So because they lack information, and sometimes they lack those services, they are at a risk of acquiring HIV.
Let me follow up on one point you made earlier. You have found ways, Josephine, to continue peer counseling in this time of COVID, right?
Yeah.
How have you had to adjust?
Well, it has not been like so much of an adjustment. So in my country,
Okay. Lucas, maybe while we're waiting for her, maybe you can.
The WhatsApp for that facility. And through that, young people are connecting with each other. So when this entire situation came up and we could not, do healthy talks at the health facilities, we then had to resume and, be more active onto the WhatsApp groups that had already been created. And in scenarios where, in cases where these WhatsApp groups weren't, we supported those facilities and those peers at those facilities to actually design and create WhatsApp groups where young people are and interactions can happen. In the WhatsApp group that I'm in, that is called the Area Superstars, we do quarterly meetings. So in a year we do around 3 meetings, and then we do one reunion in December where we come together and we share beyond HIV. Not just limited to HIV, but beyond HIV, because life is bigger than what we may have. There is employment, there is financial literacy. All those things are things that we incorporate into our discussion. Because when you just keep it to HIV all the time, people will get bored, and when they get bored, they will not listen. So you have to have mix and ensure that each aspect of an individual is being tackled about, whether education or financial literacy or gender-based violence, everything is talked about.
Yeah. Lucas, maybe you can address the issue of stigma. As you mentioned, bullying and other things. Do you think the stigma is getting better, getting worse, staying the same? And how do you think the community can help try to combat stigma?
As a whole, it's getting a little better. From what I've seen in my communities around in Boston and around in Mass, it's been improving a little bit. Not as much as it could or should be, but it's improving a little bit. And I think that all depends on how the person who has HIV goes about and discloses their status, carries themselves, and goes and has conversations about it if their friends are curious or if their family friends are curious. The first time I disclosed my status was probably the scariest moment of my life. And it won't always go the way you want. I remember the first few times I disclosed my status, I lost a couple friends. And it gradually gets easier and easier as you do it. But you just have to be honest and tell them everything that you know, and if they have anything to ask you or questions or anything to ask, then you just answer it. I remember a couple times I told my friends they left my circle for a while, and then a few months later they would come back asking me a bunch of questions and wanted my friend again because they looked it up more online and saw it wasn't as big a deal as they thought it was. And it's all about knowledge is power. And if you go into a conversation on both sides, if you're disclosing your status without knowledge, then it won't be a good conversation.
Josephine, how are you dealing with stigma in your culture?
I'll also be like Lucas. I'll admit that stigma has reduced, but it is still with us and within our communities. And when you look at why people sometimes do not go for healthy services, HIV services, because of stigma. Why they don't take their medication, it's because of stigma. So I would say that stigma is still with us, however much we've done a lot of sensitization, and there's been a reduction, but it is still with us. So one of the things that I want us to focus on, or one of the things that we focus on, is community sensitization, and we never get tired of that. Because the moment one person knows what HIV is, how HIV is being spread, and how it can be, prevented, and how you can control it, then that person is informed. Whenever you are close with a person who is informed, they can never make, words that will stigmatize you. They can never say out something that will bring you down because they know the truth. So it is not something that may happen in a bigger mass congregation and you change everyone's perspective. But individually, I think at an individual level, everyone has a role to play, and everyone should be able to understand what their role is. And it all comes from information. Do they have the right information? Because I also know that some people stigmatize people as a preventive way. They think I should not let this child use the same fork with the other child, because they may infect the other child, not because they want to do it, but because they think to them that is how they are preventing HIV. So information is very key, and at an individual level, everyone has a role to play. If we are all informed one by one, I think the community will be stigma-free. And as long as the community, as long as external stigma is not there, trust me, even internal stigma will be dealt with, because I can only get internal stigma if I've seen people stigmatize me. Yeah. Thank you.
And Lucas, is there anything your community can do to lessen stigma around you? Not just your own courage, but how can the community help?
One thing my community did to try to help is that I remember there was, I mean, there's been dance marathons at Boston University or there were for a while before it unfortunately got shut down. But that was a big thing because it was on a big campus, a well-known campus. And it was a dance marathon for 26 hours, I believe. I would go every year and speak from the age of I was 10 on until it stopped. But those are the biggest things, especially college students have the most open-minded sort of thing. And it was a big thing. Everyone, a bunch of people would come, and it would just be an awareness, and I would get asked a bunch of questions about it afterward by multiple people, college students, professors, kids that would come in off the street and watch it, parents that would come in off the street and watch it. And it made me so happy to see that an event like that, in a grand scheme of things, that small can bring. So, like, it brought about the best conversation that I always would have at these events, and that's all we need is a dialogue and a conversation about this. That once that starts, it's only up from there.
Can I ask both of you briefly, when you get these questions from your peers, what are the most common questions you get, the most common myths that you face?
The one I've gotten the most is like, how are you not, when I was younger, like, are you gonna die soon? Like how are you this healthy? Like, that they don't understand that if you take your medicines when you're supposed to, you can live what I like to call, air quotes, a normal life, just like everybody else. And I get a lot of questions asking about, I'm in a relationship at the moment, a healthy relationship, and she's on PrEP at the moment. So there's not a lot of understanding that you can have a normal, healthy, happy relationship while being HIV, like, infected and positive. It's just not a very well-known fact, and I feel like that needs to be pushed more.
And Josephine, what kind of questions do you get most common?
Yeah, most common, they vary. So you find that the little children always have different common questions. And then even the young people have different, myths and misconceptions. But when I remember from the little children, they'll always ask whether if you have HIV, you die immediately. And that is also because of the signposts that are always around our community and the schools where you'll find HIV kills. So if person thinks when you have it immediately, you die there and then. So that is one of the concepts that is always running into the minds of the little ones. To the young people, there are now many myths and misconceptions from the time of having sex. They will ask, there are always questions about having sex. When I have sex with a virgin, will I contract HIV? That is always a common question that comes to us. So they think probably if I have sex with a virgin person, they're not positive, and there's no way I will contract HIV. And then there is another myth that is common in my culture, where we have, I think that in the Western world, we can say that pygmies, like these very, very like short people in my culture. So people think when you have sex with them, you'll get cured of HIV. So, I mean, another common myth that is always around HIV, especially when it comes to young people. Yeah.
Well, let me get to some of the questions that we have from the audience that have come in. And maybe we can start just, I think this is a good one, asking, how can people outside, people like us, become better advocates for HIV/AIDS research and treatment?
There's multiple ways that I've seen. There's been not really much advocating, but more showing that or being supportive. I remember there was a big thing for me in my childhood, which really opened my eyes for me becoming an ambassador the first few years of my life. there was a furniture store called Jordan's in the New England area, and the husband and wife who opened that store started a camp that was a free camp. You didn't have to pay for it, and there was all volunteers for staff and counselors, and food and everything was all donated. It was a big thing, and they would always do a fundraiser every single year, and it's all about getting your message out there. If you want to advocate for research, you start advocating for research, or if you want to start advocating for rights and equality in medicines and things like that, you advocate for that. It's all about however you can add to the solution. It doesn't have to be a lot. It's however much that you can, but any little bit of support and dialogue helps.
Josephine, how can we be better advocates?
Well, you can be a better advocate, especially in our field of HIV, if you understand that HIV changes. When my mother had one CD4 count and she was paralyzed in her bedroom, I think all she wanted was medication to live. Currently, I don't just need medication to live. I'll think of how many pills am I taking. I'll think of how many times am I taking the pills. I'll think of what are the side effects I'm going to get. Am I going to gain weight? And if I'm to gain weight, where am I gaining the weight? So I think before the needs were more of we need medication to live, but then right now the needs are more of we need better treatment options. I need to take a pill and I do not have to gain weight. I need to take a pill and I do not have to get diarrhea. I need to take a pill and I do not have to get a headache, something like that. I need something improved out of it. The injections are coming, but we are like, okay, once in 2 months, that's not enough. I need one injection in a year. You get? So we need to understand that the needs are changing from just, services or treatment or whatever is there offered to us to survive to actually having better lives currently. And those are the needs of young people currently. The medication is there, the services are there, but we need them to fit our need currently. And, sometimes our needs are not met, especially when you come from the treatment side, the number of pills people are taking, how many times they're taking them, the side effects involved. So I think as a better advocate, you need to know what is changing. We are no longer into the era of take medicine for survival or access, treatment or services for survival. We need better services and better treatment.
Chip, is it possible for you to chime in here and talk a little bit about what the next frontiers in HIV/AIDS research are for young people, for children and young people?
I'm happy to, Mike. Thank you. I would also, on the point of how to be better advocates, I think both Lucas and Josephine answered that really well. But at the end of the day, and particularly in the US and for folks on this call, one of the most important things is contacting your member of Congress and just saying, as a voter, as a taxpayer, one of the most important things that we can do is to make sure there's adequate funding for the NIH, for PEPFAR, for the Ryan White Care Act. These are all vital, vital programs, and the research they do. The reason we've made the progress we have, the two main reasons, besides political leadership, Mike, of President Bush and Senator Kennedy, is one, because of the scientists are doing their jobs and they've given us far better treatments. They've given us so many breakthroughs. And the other is because of the activists and people like Lucas and Josephine and others. The rest of us need to catch up with the activists and to support the scientists. And that's a matter of funding, and that is Congress that can make those kinds of decisions. The most important research, the Holy Grail is a cure, and folks are working incredibly hard at finding a vaccine or a cure. In the meantime, they're very good ARVs, but antiretroviral, the medicines that Lucas and Josephine are talking about, but they don't provide a cure. They just keep you suppressed, the virus suppressed, so that you can live a full and healthy life. Some of the other research that is underway that's really important is, and again, they've already raised this, how do you have long-acting medicines? So an injectable where you get it, say, for 6 months, and you have sufficient ARV coverage and prevention for those 6 months. Those are the kinds of things that are, I think, going to be on the frontier of research.
That makes sense. Maybe I can ask all three of you, if it's possible, how have the US and African countries prioritized people living with HIV/AIDS in the COVID response? Has this been an effective response or not when it comes to accommodating the COVID pandemic?
I'd like to hear from Lucas and Josephine first, and then I'll weigh in.
The representation has been kind of, it could have been a little bit more. I mean, there's, of course, they give you all the ideas and tools that you need to go and stop transmission with wearing gloves and wearing the mask and hand sanitizer and staying 6 feet apart. But they don't really understand that how someone lives with a suppressed immune system, how easy it is to get certain infections and certain viruses and colds. I remember when I first started on my medicines when I was a kid, I got colds every single time. I had pneumonia 4 times. It's really depends on, they need to advocate for youth with HIV to go, well, first of all, take your pills. That's the most important thing, that through all this, you need to go and take your pills, and to really go and be aware of your body, what you're going and putting in your body, where you're going and interacting with your body, and just what you need to listen to it. If you feel symptoms, go into a hospital. But you have to be extra, even going into a hospital now, it's incredibly risky, especially for someone with a suppressed immune system. So they could have done a little bit of a better job going and explaining to that community how to go and prevent the transmission. But
Josephine, how do you think that people with HIV have been prioritized in the COVID response? Has it been effective or not?
I would give it a 50-50 mark, because when you hear the government officials speak, you know, the plans are very good, but then somehow on the implementation, it is somehow different. So that's why I would give it a 50-50 mark. I think they've tried, but they've not done their best. For example, at least throughout my contacts, all people have had to, like, if you go to the facility, there is medication. Even when there is no medication, at least an alternative drug will be given to you, but you cannot go without medication. And that is a plus for me. However, of course, there are different challenges that come up with having an alternative drug, yet you are used to taking another drug. But the fact that there's been medication there, the means of accessing it has been hard, but at least you know that when you go to the facility, you will get the medication that you have to get, or you'll get an alternative in case there is a drug stock out of a particular treatment. In terms of psychosocial support, I would say that the response has been a bit good, especially us when we're not so used with technology, and then we have few young people accessing smartphones. So only those that have access to internet, that have access to smartphones, have been reached out. But those that do not have access to such gadgets, what are we doing for them? Is it just a phone call? It could be a phone call, but some of our systems do not track phone numbers. So I find that there have been some loopholes, and we've presented these lessons learned to our government, so that next time we are best prepared, for such emergencies in case that happen again. So I would say 50-50, because some policies that have been presented to us have helped us, but then somehow in the implementation, there's been gaps.
Yeah. Chip, it's been one of my concerns in all this that you have a COVID pandemic on top of a food crisis, a growing food crisis in the world. And are we going to undermine a lot of the progress we've made over the last couple of decades on HIV and other diseases as well, but HIV in particular in this current crisis?
We face the real possibility of that, Mike. Josephine's right in terms of 50-50. On the implementation side, where it falls off, and since we're in the business of implementation, we and community groups and all those that we partner with, if this was a real priority, then other kinds of things have to be put in place. You cannot continue, and it speaks to your larger point, Mike. Our objective is to continue the best possible services that we can to reach the greatest number of people who have vulnerabilities, to keep people who are on medicines on medicines. In order to do that in this environment, you have to provide PPE, personal protective equipment. And that is not available at the scale and consistency and quality that is required. And so if reaching out and making sure that those with HIV or at risk of HIV were among the highest priority populations in a COVID response, there would be other kinds of things that would have to be done. And not just from a policy point of view, but from an ability to serve people point of view. We're obligated, we have a duty to say that the first priority is the safety of our staff and the healthcare workers. If they don't have adequate PPE, they're not going to be able to continue to provide those services. Where there's a void, a fall off in services, it will be filled by the virus. It will be filled by HIV. There will be new infections during this period. Testing is not continuing apace. Clients are fearful of going to health posts because of COVID, as Josephine and Lucas have said. So we are going to see a setback, Mike, from all of this. We don't know enough right now. We're feverishly trying to collect data and assess the situation. We're going to have to articulate a kind of recovery agenda when we turn the corner on COVID. We need to be able to reach out back and get people back into services, back on medicines, retest those that may very well have been infected during this period. It's going to be a big setback, but we just don't know the scale of it at this point.
You did mention as well the importance of Congress in all this, but they are in the process right now of considering how big, if any, spending is going to go into the supplemental, the coming supplemental.
Correct.
These issues, and it's going to require a significant amount of money to deal with these intersecting crises that we're seeing in our world.
100%. And it's not just an HIV issue, it's a humanitarian issue. People on the move that are highly vulnerable. The food insecurity that you referred to. So much of the economies in poor countries are in the informal sector. People don't have work, they don't have money at the end of the day, they don't have food, as Josephine articulated incredibly clearly. And so it's going to take very substantial resources. And so far, the focus by the Congress has not been on the global health and the global impact of COVID. And it needs to be there. There's a lot of support for that. There are a lot of organizations raising their voices to that end.
Right. Maybe I can close with one question for both of you, Josephine and Lucas. If you have one or two messages to leave with our political leaders in addressing HIV in youth, what would they be? Lucas, maybe you can go first.
Okay. One of the messages I would leave is just they've done so much work in the past through all the bills that EGPAF has passed with Elizabeth and all the work that she done and the senator has done himself. And they pushed so hard and they got so many results from that push. But I think especially now in these times with all this going on, both health-wise and human rights-wise, it's just to not stop the push. It's just to keep going, and eventually on that grind, something good will come out of it. And down the road, answers will come. It's just about the work needs to keep being done. And that's what I would leave with them.
Now, that makes a lot of sense. And I really do worry that people don't understand how much good can be undone so quickly in a crisis like this, where gains you've made can be lost. And that, I think, would be a real shame, having really focused some attention on this issue. Josephine, what messages would you leave?
Well, I will not differ from what Lucas has said. I think we've written a lot of success, and we cannot unwrite it, towards the end. We just need to keep moving so that, we can be able to overcome and we can be able to realize an HIV and AIDS free generation. But also, I want to say that HIV needs are different according to people, according to age, according to regions. So what the US may need is very different from what the Ugandan community will need. Even in Uganda itself, what the capital city people will need is very different from what the rural people will need. So our needs in the HIV field are very different. And if we only meet one need and leave out the rest, you're still not going to achieve the goal that you want to achieve. So it's important that we realize that people are different and regions are different, and because of that, that different needs to be met individually, regionally, and country. Thank you.
And Josephine, how much is Uganda facing this food insecurity issue right now, and is it likely to get worse?
So it is hard for me to quantify it and say maybe it's at this percentage, but that we are having, whether through social media or through phone call from different young people and different colleagues, everyone is crying out, there is no food. However, it is very, very heightened for people in the urban centers, because those are people that mainly live on a daily earning. So you will find that sometimes people in the rural, because they have access to gardens, they can be able to farm and acquire food from their garden. But a person who is renting one room in the capital or in the city, does not have a farm, does not have land where to garden from. So actually such people are even more at, they have a bigger burden to not to access food at all in their lives.
Right. Well, I think the message today has been pretty clear. COVID-19 can bring many bad outcomes, but one of the worst would be to let it undermine decades of progress in the fight against HIV/AIDS. That would be to add tragedy to tragedy. But there are leaders calling attention to that risk, and we've heard from two of them today. So let me close by thanking our two panelists for their eloquence, for their idealism, and for their example. Thank you for staying healthy and engaging your peers and challenging the broader community and doing all of this in the midst of social distancing. And thank you for inspiring us here today. Now, I think Chip may just have a few recommendations for resources if people want to read further on this set of issues having to do with the dual pandemics.
Happy to, Mike. Anyone that's interested, we encourage them to visit two websites, either of the websites for the Institute, and that's emkinstitute.org. And the other is EGPAF's website. There's a remarkable COVID-19 and HIV resources there that are updated. And so people would find a wealth of information, and that's at pedaids.org. That's PEDAIDS.org.
Well, thank you all for a great discussion. It was really enlightening. Appreciate it.
Thank you, Mike. Thank you, Josephine and Lucas, and Mrs. Kennedy, likewise, and the team. Terrific to work with you. Thank you.